Hello and welcome to our segment this week at the Smith Surgery Institute of Las Vegas, which is located on West Sahara. Now I'll be talking to Dr. Smith today about a woman named Kathy who is going to see him for a consult for a possible facelift. So Kathy, you are here today to get a consult from Dr. Smith about your desire to have a facelift.
Yes, and I'm really excited. Finally, the day is coming.
So can you tell us what would make her a good or bad candidate for this?
Sure, thank you. Kathy is actually an excellent candidate. She takes good care of herself. She's about the right age, and her weight is about the right weight. Facelifts do not work quite as well on someone who's very heavy, and sometimes if they're too thin, it's not quite ideal either. She's perfect in that way. And then her skin is about the right amount of laxity for an actual full facelift. We'd want to do probably a full face. She's not a good candidate for a mini facelift. She's going to need a full face and neck lift, but she'll have nice changes. She'll have a very nice change. Truthfully, the thinner skin, so she's a blue-eyed, thinner skin, that actually pulls a little better too, so we get actually a little nicer pull. Sometimes when the skin is thicker, it doesn't pull quite as well, so we get a little nicer pull too.
Now, when you said a mini lift, I think on TV you see a lot of infomercials about facelifts. Can you tell us a little bit about that and her?
Yeah, a lot of those infomercials are, somewhat suspect. In fact, one of them was fined $300,000 for making false claims on the internet.
Yeah.
But the fact is, the advertisements that you see where there's really huge changes, I suspect that there's more done than they're actually telling you. And when they make the claims that you can, be completely better in 2-3 days, I have not seen that even with a mini facelift on any patient.
Yeah.
All plastic surgeons can do all types of facelifts, so there's not one area you have to go that says we do this certain lift and only us. It's surgical techniques are not patentable, so they're not. Nobody can just, I'm the only one who can do this special surgery. Plastic surgeons are trained to do mini lifts and full lifts. And if she was a better candidate for a mini lift, we'd certainly do that. But she will need a full face and neck lift. But the advantage of that is, she's going to get some big changes. The bigger the surgery, usually the bigger the change. Other things that we do now, instead of just pulling, it's not only a question of pulling. Other things that we do that are very helpful is usually we'll also fill a little bit. We'll put a little bit of fat, usually in the cheeks and usually in the nasolabial folds. That's the main change in the facelift of 2010 versus the facelift of 1990. Okay. We've been pulling for years and years, but we've now discovered that the face as it ages also loses volume. So if you look at pictures of Kathy when she was 25, you'll find that she had full high cheeks. And some of that is, the fullness has dropped, but some of it is the actual thickness of the subcutaneous fat has decreased. So as we age, that baby fat goes away. And that baby fat is what makes you look young. So we put a little bit of fat back. Patients always ask me where we get it, and I always tell them from me. No. The truth is, it won't work.
From me?
I get it from you.
Okay. Where from me?
And where from you? Usually we get it from the stomach, actually.
Okay.
We take a little bit. We don't need a lot. We just need a tablespoon in each area, a tablespoon in each cheek.
Well, it's a good place to take it from.
And that's all we need. You won't even notice that it's gone. And then we usually put a little bit here, too. So it's like a permanent filler. So when we enhance the volume a little bit and lift and pull, we'll get a very natural look instead of a pulled or stretched look. And we'll get a full, youthful look. It's a very powerful change.
Well, Kathy, thank you for sharing with us today. I appreciate it very much, and thank you, Dr. Smith.
Thank you, you guys. Thank you.
I can't wait to show you the hands.
For more information or to schedule a free consultation, call 702-838-2455 or email Dr. Smith at smithsurgery@aol.com.